Well, hello everyone. In today's video, we're going to talk about who would be the best presidential candidate when it comes to Medicare. So yeah, I'm really excited. This is going to be fun and light and unbiased, okay? Just going to lay down the facts when it comes to Medicare and healthcare, okay? So we're going to talk about the things that Donald Trump has supported and not supported, and the same thing with Kamala Harris. So yeah, let's get right into it. Like I said, this is supposed to be fun, unbiased, and let's get right into it. All right, so the first category, we're going to talk about ACA, which is Marketplace Health Insurance, also known as Obamacare, okay? So first, we're going to start with Donald Trump, okay? So let's get right into it. So in 2017, Donald Trump unsuccessfully, unfortunately, it was unsuccessfully, he attempted to replace the ACA with various plans that would have increased the number of uninsured Americans to 51 million, okay? Unfortunately, this was unsuccessful, but that was his plan. He wanted to replace ACA, okay? Trump said Obamacare sucks, okay? And that he would replace it with much better health care, but unfortunately, he was unable to make that happen, okay? So what else has he done? He expanded non-ACA compliant, which is short-term plans, which restrict coverage for pre-existing conditions. So he did expand that, but it does not cover pre-existing conditions, okay? So that's ACA. Now let's talk about Kamala Harris when it comes to ACA. So the Biden and Harris administration passed the American Rescue Plan Act, which temporarily expanded eligibility for and increased ACA marketplace subsidies. These were extended by the Inflation Reduction Act through 2025. So basically, they help individuals with subsidies that help with the monthly premiums and co-pays and such. So that's great. They also fixed the family glitch. So what's the family glitch? So this allowed dependents of people with unaffordable employers-based family coverage to receive ACA subsidies, okay? So that's the category of ACA. Now we're going to talk about prescription drug coverage. So what did Donald Trump do and Kamala Harris? So Donald Trump established a voluntary model allowing participating Medicare Part D plans to limit monthly insulin at $35 copay, which is really good. So if that Part D plan had a insulin that is in its formulary, then the insulin would be capped at $35. This was done 2021 to 2023, and it's still going on right now. So yeah, he's the one that got insulin capped at $35 copay. So, okay, Donald, I see you. Okay, he created a new pathway to allow states to import prescription drugs from Canada. Yes, Donald Trump was the one that created this pathway to allow prescription drugs to import it from Canada because the medications from Canada is a lot cheaper than here in the US. All right, so that is Donald Trump when it comes to prescription drug coverage. Now let's talk about Kamala Harris on this topic. Okay, let's get right into it. So Kamala Harris cast the tie-breaking vote in the US Senate for the Inflation Reduction Act, which requires the government to negotiate prices for some Medicare-covered drugs, okay? And this is what helps with this. It caps out-of-pocket drug spending. It limits monthly insulin costs to $35. Remember, Trump was the first one that put that in place, but she did the tie-breaking vote that helped pass that through, right? So it limits monthly insulin costs to $35 for Part B and Part D plans, which is really nice. And it improved financial assistance for low-income beneficiaries, and also approved Florida's plan to import some prescription drugs from Canada. So that is the category for prescription drug coverage. They both did a great job, right? Yes. Please take a moment to like this video. Give it a big thumbs up if you are enjoying the content. It really helps others to find this video, and it helps the channel a lot. Thank you so much. Moving along. So before we move on and we talk about Medicare, I want to remind you guys, at the end of the day, we are neighbors, we're friends, we're family. It doesn't matter what side you're on, blue or red. At the end of the day, the people, us, would be the one that have to deal with the health care and Medicare, the cost of living and such. Do not let any of these candidates divide us, okay? Because trust me, their health care is fine, okay? They're getting all the care that they need. They have all the money that they need. At the end of the day, I do believe in the human race, because when it's time for us to really get together and show support, there's so many good humans in this world. So we the people will be the ones that would have to live together and be neighbors and help each other in needs and such. So remember that. Moving along. Let's get to the last category, and we're talking about Medicare. All right, Donald Trump. So he promises to always protect Medicare, Social Security, and patients with pre-existing conditions. Okay, no particular policies proposed, but this is his promise. Okay, he proposed to eliminate taxes on Social Security benefits. So Medicare Part A right now is $0 per month because we pay into this. This is what we're paying our taxes towards, Medicare Part A. And he promised to protect this, okay? And the Social Security Trust Fund when it comes to Medicare Part A. He expanded treatment for substance use disorders and other mental health conditions, and to allow Medicare Advantage plans to offer additional benefits for chronically ill enrollees. He increased Medicare premiums for higher income beneficiaries. He broadened coverage for telehealth, easing staffing requirements for Medicare certified nursing homes in response to COVID-19. Alrighty, so now we're going to go ahead and talk about Kamala Harris when it comes to Medicare. So Kamala Harris proposed to protect Medicare for future generations by raising Medicare taxes on high earners and closing tax loopholes, okay? She proposed to expand Medicare and Social Security, no details there. The administration expanded coverage for mental health services and access to additional mental health providers, extended broader coverage for telehealth through December 2024. She cast the tie-breaking vote in the U.S. Senate for the Inflation Reduction Act, capping medications at $2,000, okay? Before, the cap was $8,000. So this is going to actually take in place in 2025. Medications would be capped at $2,000, which is a great thing, okay? Including negotiated drug prices and insulin being capped at $35. During the 2019 Democratic presidential primary, she supported Medicare for All approach. Now, however, since she is running for president, she would not seek to advance Medicare for All as president, and has supported the ACA and expansion to broaden coverage and make healthcare more affordable. Alrighty, so there you have it. That's their standpoint when it comes to Medicare. I will say this, both sides do truly believe in Medicare, which is a great thing. I do believe that either way, both sides will definitely protect Medicare, which is a great thing because I really believe if any of them did not support Medicare, they would not even be running. They wouldn't even have a chance. So there you have it. Thank you so much for watching today's video. I hope you learned something new today. If you like the video, please give it a like. And if you know anyone that needs this information, please share this video. If you have any questions, leave them in the comment section below and I'll be more than happy to answer your question. If you need any assistance, give our office a call. We'll be more than happy to assist you. At the end of today's video, there are 2 videos that you can also watch. Please subscribe to see me again, and I'll see you on the next video. Thanks for watching. Bye.